Is my audio better now?
Okay, so good morning, everybody. I see we've got quite a few attendees already. So welcome to the Devon International Recruitment Hub webinar. This is webinar number 4. We always run these webinars on a Thursday between 10 and 11. So welcome, and hopefully some of you would have seen this session advertised on social media yesterday. So today we are going to talk about an introduction to your OSCE. So I appreciate that a lot of you will be worried about the OSCE and what it looks like. Over the last few weeks, we've heard stories of our own international nurses talking about their journey to the UK and the process they went through, which was very popular. So we're very fortunate today in that we've got Tella with us, who is one of our international nurses, and she's also an OSCE trainer. So Tella is going to give you a brief introduction to the OSCE. Obviously, we've only got sort of 30 minutes to allow time for questions at the end, so this will be a very brief introduction to the OSCE. But please put your questions in the chat box and we will answer them at the end. Obviously, if you've got any other questions regarding the recruitment process, pop them in the chat box. But we've had a lot of movement this week in terms of causes being issued and visas starting to come through. So it's all very exciting indeed. So what I forgot to do is introduce myself. So my name is Carly Boyce and I'm the Devon International Recruitment Hub Pastoral Lead. So I run these webinars, and then at the point that we issue COS, I'll be doing more webinars for those people and getting in touch with them, linking you in with your clinical teams and the new organisations, and making sure that that process is as smooth as possible for you, because we realise it's a very daunting time. So I'm going to hand over to Tella, who's one of our OSCE trainers in Devon, and Tella is going to talk to you about introduction to the OSCE. So I'll leave them with you, Tella.
Hi, thanks, Carly. So Carly's mentioned, my name is Tella. I'm one of the international nurses already in and as well now as an OSCE trainer. So introduction to OSCE. So first, before I jump into it, I know it's very important for most people come over to actually have a bit of an idea on how OSCE works, but also to give you the reassurance that the training that you will have when you come over, regardless of where in Devon you're coming, you will have a very detailed kind of introduction, as well as you get a glimpse of what OSCE is all about. So yeah, so OSCE. So the OSCE exam is a practical aspect of your NMC test and competence. So you've done your CBT, which is your written aspect. Now you move on to the practical aspect. You are going to be tested on clinical skills and as well as your communication skills. And you have to be able to demonstrate how you apply your basic knowledge on how to provide holistic care for patients in a kind of patient-centered nursing, and be able to apply your clinical skills. Bearing in mind as well that OSCE is set at a level expected of nurses at their point of registration, which means that you must show how you are able to apply knowledge and skills in caring for a patient at the level of expected of a newly qualified nurse. Right, so practical aspect of tested competence of NMC. So you've got 6 stations. You are going to have 6 stations when you go for OSCE. This is for the existing OSCE at the moment. You might have heard that it would be changing starting from August. I'll give a brief overview about that at the end of this. So focusing only on the existing one, you are tested in 6 stations. So you've got your assessment, planning, implementation, and evaluation, which is what we fondly call as APIE.
Tella, would you like us to share the slide with the OSCE timings on them?
Yes, please. Thank you. And then after that, you will also be tested on 2 different skills. So for, I think that's being shared at the moment, the timings. Yes, so there it is. I think if we can look at the old task first, if that's okay.
So the current one is in the white column on the left.
Right. Oh yeah, sorry. So we've
That's
got
okay.
the current one, which is 6 stations. So as I've mentioned, we have the 4 stations first, which is your APIE, assessment, planning, implementation, and evaluation, and we got the 2 skill stations. So for your APIE, you're going to have a scenario. You'll be given a scenario either in a hospital setting or a community setting, which would be in a patient's home or in a residential home. And in that scenario, you will have a chance to read that scenario before your station starts. So relevant documents such as an admission document detailing about whatever it is that you need to know about your patient. And you've got for assessment, so that's your first station, you will be given 12 minutes to complete an assessment on that patient. So what you're expected to do is to do a set of observations, your vital signs, you've got your blood pressure, heart rate, and the like. Then you're going to have to record your observations in a given chart. So it might be different. It has to be tailored fit to your scenario. So if you're in your hospital scenario, there is a chart, there's a different chart and another chart for community. Yeah, so after you've recorded those, you are then given the chance to talk to your patient about their activities of daily living, kind of getting a picture of how your patient is at their baseline, so before admission, or and as well as if that's changed since then. What that allows you to do is when you move on to planning, you have gathered enough information for you to make 2 relevant care plans. Bearing in mind what the focus is on. So what do I mean by that? When you're given the scenario, they give you things to focus on. Say you meet a patient who's come in for abdominal pain and has been diagnosed with something that requires surgery. So they will put at the bottom of your scenario saying focus on pain and anxiety. So that kind of gives you an idea what to kind of narrow down your questions into those 2 things. And when you move on to planning, you would be making care plans based on whatever you've been given to focus on. It's 2 care plans. And for planning, you will be given 15 minutes to complete those care plans. And when you move to your implementation, they call it implementation, but it's administration of oral medications. So here it's the same patient. You're going to have time to read your scenario again. And then as you go into implementation, what you're going to do is be able to demonstrate how you are safe in administering medications. So with that, you have to demonstrate your basic knowledge about medications. Say, for example, you're tasked to give a blood pressure tablet. You have to kind of show that I know this is a blood pressure tablet, so I'm going to check the blood pressure first and see if it's safe for me to give this. Another thing is, say, for example, your patient is allergic to penicillin. So among the medications prescribed would be amoxicillin, which obviously your basic knowledge would tell you not to give it because it has penicillin in it. So with that, you kind of have to show like, yes, I know it has penicillin, so I'm not going to give this to you because I'd like to keep it safe. So those are the things that what they look at for implementation. And obviously the safest way to document is found that you've given the drug or you cannot give the drug because of this reason. So you have to be able to show that. And then you got your evaluation, which is also a 15-minute station. Here it is a written station, just like planning. So you're tasked to complete a document, which can either be a transfer letter or a discharge letter. So kind of giving an overall picture of how your patient is so that the care can be continued, like a handover. So with the APIE, it's the same patient all throughout, but bearing in mind that scenarios can change in between. By that I mean, say for example, in assessment, you meet a patient who's coming for abdominal pain and is for surgery the next day. So that's your scenario. Then what you might find is when you reach evaluation, sometimes they say that the patient has already had surgery and it is now day one after the operation. So what you have to do is be very careful about the scenarios that you read, making sure that any new information you know how to handle or you know to address. I think I think most people who are very curious about OSCE would go online and look up different scenarios or even YouTube videos. That's all fine. It's not really discouraged for you to do that, but also bear in mind that there are updates that the test centers give you every now and then, and what you might find online is no longer in date or updated. But if it's just for the purpose of knowing how candidates go about it, then that would be a good idea. So that's your APIE. And then for the 2 skills, so you would have to kind of familiarize yourselves with, now it's 11 skills. It used to be 9 skills, but they've taken out the basic life support because of COVID. So they were testing for 8, but they've introduced 3 more. So I'm not going to go in detail about each skill, but it's 11 skills that you have to learn, but they'll be only testing you to. So do you get to know what skills you will be tested on now? So you would have to find out when you reach the test center and it's your exam time. So it's a surprise. But like I reassured you, the training should be more than enough to prepare you for that. So those are your 6 shifts. So question, how are you being assessed or how are you being graded? So if you have a look at the NMC website, the test of competence where they discuss OSCE, they actually have documents there that they suggest for you to read. So one of them is the test blueprints. So the test blueprints show how the standards of proficiency and associated skills and procedures for each part of our register may be tested by the test of competence, meaning they detail kind of what you should know and how to relate that in your delivery of your test. That makes sense. So mainly they check if you're safe, if you're adhering to the code, which is something that you also have to kind of read. It is very important that you read that because that will also guide you in your practice even after OSCE. And so yeah, so APIE, 2 skills. So I think what to read. So what can you read while you're waiting to come over? One is the code. Second would be if you go onto the NMC website dedicated to about discussing your OSCE, you can go on that. And what they also say to you is that there are 3 places that, well, test providers really in the UK. So you've got your Northampton, your Oxford Brookes University, and your Ulster University. So those, if you go on to any of those websites, they actually have details on how to go about your OSCE as well. They also publish resources such as your candidate booklets, what to expect, what to bring, and even example scenarios that you can already familiarize yourselves with and kind of practice in your own time. So there are those resources. And between those resources and YouTube videos, we always suggest to go for the ones that the test centers provide because they do update them every now and then. which would be more reliable than compared to the YouTube videos that you may come across. So on a personal note, going through OSCE, I had a training when I was here. I've only been here for a month, so I did a month in the ward. Then I did the OSCE. I did OSCE training for a couple of weeks. Is that enough time to cover everything? Yes, but also I think it is important to kind of spend a little bit of time more practicing things, because a lot of it is what contributes to your success is definitely practice. So you can practice on your own time, and I think all the trusts in Devon, we kind of give you a booklet which has kind of like checklists, a kind of a detailed guide on how to go about your OSCE. So yeah, I think covered everything. Yes, I think I've covered everything. Also, just to go back to the reassurance that your training will definitely be enough to prepare you for the exam. Are there questions then?
Thanks, Tella. They're all very quiet this morning about questions. So yeah, guys, put your questions in the box there. So I've put the link to the NMC test of competence blueprints in the chat box, so people can click on that. And like you said, that the blueprints are there, and there's a lot of information on the NMC about the OSCE. And I tell you, another good source is the Royal College of Nursing. I've got quite a lot of OSCE resources. So that's another one that they could look at. So yeah, so I guess for me is, what would you say was the most difficult part of going through the OSCE process as an international nurse, Tella?
Definitely, I think the pressure, not from the trust. It's more of, I think, because all of us kind of want to get this over with and just jump straight into learning the practice and everything. So there's that pressure that we kind of put on ourselves to, we have to pass this first day or something like that. That was the most difficult thing for me. As well as obviously the language, definitely. There are terminologies that are very different. Like, just to give an example, we have we always say vital signs instead of observations, although that's kind of like a universal thing as well. You kind of understand what it, but it takes some time to get used to that. And when you're an international nurse and your English is not your first language, you kind of have to work extra hard, like twice as hard, because you kind of have to translate things in your head. But how to overcome that? Number one, to not be too conscious about your grammar, if that makes sense. Because as long as you're able to communicate clearly, you're fine. And second is just practice. The more you do it, the better you are at it, and the more comfortable you are saying something in English.
Thanks, Tella. So we've got some questions. I think I was looking in the wrong bit. So we've got a question here. How long does it take before we're presented for OSCE in Torbay and South Devon Trust? So basically, you pretty much start your OSCE training within the first couple of weeks of arrival, and that's it with all the organisations in Devon. Now, they book your exam in with the OSCE test centres. Now, that's the only thing that can sometimes cause a bit of delay if they can't get you in for an exam slot quickly. And that's because obviously the NMC have only got so many test places, but they have just increased their testing capacity. And I know they're opening up new exam centres in the UK, so that should get a lot easier. So you will start your OSCE training almost immediately on arrival, and we present you for OSCE as soon as we can get you in for a slot. But to be honest, the average time, I would say, between 2 and 3 months, you've normally done your OSCE training and had your exam. Would you agree with that, Tella, for Exeter?
Yes, definitely. Like we said, it always depends on how soon we can put them in for a test. And obviously, you want the training as close as possible to your date of test date.
Yeah.
So yeah, it all depends on that.
Okay. So there's a question here about the new OSCE changes. So it's from August, but we haven't been told what date yet. The NMC haven't said which date. So that we're getting a massive rush of people trying to get in on the old OSCE exam at the moment because they don't want to have to learn the new stations. So obviously we have got, depending on when it is in August, I would have thought most people that are arriving in August would take the new test, which we're currently looking at the moment. So it says here, thanks for these sessions. However, I find a bit difficult online because of network issues. Would you also train us when we reach out? Yeah, absolutely. So if you come to Devon, you will have an in-depth OSCE training program, no matter which hospital you're based at. Yeah, absolutely. And like Tella said, you absolutely get enough training. So which will be our exam centre? Well, at the moment, we tend to send our candidates to Swindon. However, because I know that there are going to be more test centres, it may be that there'll be a closer one, but at the moment it's Swindon. And we, sort out train tickets and all the rest of it and get you up there. And there's a little hotel right next to the test centre, and there's also a KFC. Which everyone goes to tea for. So yeah, that's normally the process. Okay, so there's another recruitment question here. There was a gap of 1.5 year experience when I attended the interview. Now I have exactly 2 years of experience gap. If I wait for long to receive my COS, my experience gap will increase. So could you? Okay, so are you able to? The question about COS is, could you please contact the recruitment team? The Devon International Recruitment Hub team. Oh, here we are. Jack's just replying. Jack's one of our recruitment partners, and he'll be able to assist you with that. See what else is there. For the exam, for the OSCE exam, how much stations do we have to cover and how much care plans? Would it be 2 actual and 1 potential? Are you able to pick that one up, Tella?
Yeah, so yeah, for your OSCE exam, it will be 6 stations. That's for the existing OSCE. And then for the care plan, so you are given 15 minutes to complete 2 care plans. So whether it is an actual or a potential one or a risk one, that depends on you and your scenario. So you've got scenarios where you have to make it make care plans on 2 actual problems, but it might be depending on your scenario, you might have to do 1 actual and 1 potential or 1 risk. So it really depends on your scenario.
Tella. Okay, I think, oh, here we go. Yep. Okay, so we're up to date with questions, so keep them coming at the moment. Go on, Tella.
I think just to add with the new OSCE, I think I said I will go over that, but I completely forgot. But with the new OSCE, you will be having 10 stations. So still your APIE will be there, your assessment planning, implementation, and evaluation. Then you will have 2 skill stations, which they will pair. And you have 2 silent stations as well, which is your evidence-based one and your professional values. When it comes to when it will be implemented, like Carly's mentioned, sometime in August, but to reassure you as well, if you've taken the old CBT or the current CBT, because they have yet to change it, I think, you would still be sitting the 6 station OSCE. With the introduction of the new CBT, if that's what you're able to take, then you would be taking the new OSCE.
Thanks, Tella. So from your experience, Tella, what are the sort of stations that most people tend to stumble on?
Oh yeah, good question. It's mostly assessment, and it's because it's really short. So to be honest, it's kind of difficult sometimes to squeeze everything in 12 minutes, which is understandable. And people always kind of stumble on documentation. I think with the rush of wanting to cover as much as you can, they kind of failed to complete the documentation. That's happened to a lot of candidates. And to be very honest with you, I failed my first attempt of OSCE. Same because of documentation. One, the boxes were really small and I have the worst eyesight ever. And I didn't spot it. And I only had 30 seconds in the end to kind of check my documents. I completely missed that. I didn't put the time in. That's all.
Yeah.
But of course, when you're being safe, you have to be able to document that. So I understand why I failed the first time. So when you do your training, we actually constantly remind you, make sure you have enough time to look at your documentation in the end, make sure that you've completed it. So
Yeah, and I think that's really good advice, Teller, about just double checking if you've got minutes spare at the end, going back over, double check, because you know we've had some nurses that have been through the OSCE that because of the nerves at the time, they've made a silly mistake. But I know if they've gone back and corrected it, they've managed to pass. So yeah, just whatever time you have left at the end, just go back and double check your work. So we've got some questions here about COS, which Jack I can see is replying to. So there's a question there. Is it difficult to pass the new OSCE?
I wouldn't say it's difficult. I would say it's just new. And obviously, there's always that learning curve that even with the training, you have to adjust. But rest assured, I think it's true for all, no matter where hospital you're going to end up in Devon. All of us have been preparing since it's been announced. So there have been a lot of webinars held by the test center just to kind of discuss what's new, what's changed, and we're all keeping ourselves up to date.
Yeah.
And what's really good is that they've released a reading list as well for the new stations. So we've been kind of just learning them by heart and kind of incorporating them in our training. So we would be fine.
Thanks, Teller. So there's another question. Is it recommended to read the procedures from the Royal Marsden textbook? So they do recommend that, don't they, the Royal Marsden, in terms with the clinical stations? So yes, if you can get your hands on the Royal Marsden book, then that would be a good investment. You will also be issued with the OSCE handbook. So I'm working on the OSCE handbook at the moment. So we have one for all of Devon. When you get to COS stage, I will start getting in touch with you guys and start giving you the OSCE handbook so you can start that process. So by the time you get to your hospital in the UK, you've got a reasonable understanding of what you need to do, because a lot of the stuff in the OSCE handbook for the clinical stations, they're checklists, and it's almost like an actor learning their lines. And so the sooner we can start that with you, the better. And that's something that I'll be leading on. So there's a good question here about the cost of living in Plymouth, which I see Jack has answered. Yeah, so question here. I would like to know if we need to appear new OSCE or the new, so old or the new one. I'm currently in my country waiting for visa. I may not make out OSCE before I pass my, so if you did the old CBT, then you should do the old OSCE. So I hope that reassures you.
And just to say as well, with the introduction of the new format of OSCE in August, doesn't necessarily mean that they will completely erase the old one. So there might have to be months where they overlap, where they are still holding tests for old OSCE format and the new one. So just like Carly said, if you've taken the old CBT, then you will be taking the old OSCE.
Great, thank you, Teller. Okay, so any more questions for Teller about the OSCE? Pop them in the group chat. Yeah, and another comment, great to have an OSCE textbook. Thanks a lot. Yep, I'm just working on it now. And I will be circulating that to you. So obviously these webinars are open to everybody at the moment. So please pass on to your friends who may be interested in joining Devon. And then at the point that you get your COS issued, I will start to get in touch with you and we will start to do more of these. And I will be introducing you to your clinical teams, dependent on which hospital you're going to be working in, so that you've made friends before you get here, and it just relieves some of that anxiety for you. But yeah, we will be looking at the OSCE textbook. Is OSCE easier than CBT?
Well, it's kind of difficult to compare, seeing that like CBT is your written part, whereas it's kind of different kind of preparation that you need as well. With CBT, if you read the textbooks or the recommended, whatever is recommended on the reading list, then you should be covered. But whereas with the practical aspect, you've got like a lot of variables to consider as well. You know, are you an anxious person? That, you know, anxiety and just being really nervous about the test can impact that.
Yeah.
So it's kind of difficult to compare them with each other. But with what Carly mentioned as well about booking trains and hotels and things like that, part of it to make sure that you're in the best mindset possible when you take your OSCE exam is we do book you for hotels, I think the night before your exam. Or if you have to travel on the day, it would still provide you with enough time to kind of just relax and gather yourself. So it won't be, and I find that really helps. In my case, my exam was in the morning, so I had to travel the night before. And like Carlos mentioned, the hotel is just 5 minutes on foot away from the campus where you're being tested. So that kind of really helps not to worry about getting lost, things like that. And there's a KFC there. You don't even have to travel far to go for dinners. So we besides the detailed training that we get, we kind of prepare stuff. We put stuff in place to make it easier for you. Like, you know, hotels and trains and everything.
So I see, so Tracy's on the call. She's Tracy, are we able to get Tracy actually on the call, Jack? I see she just popped a comment in the chat box. So she said the 3 in North Devon are sitting in August have been notified by the NMC that they will sit the old OSCE. So that's interesting. So that's still August. So so Tracy's one of our OSCE trainers in North Devon. So we'll just see if we can get her on the call as well. So let's just check the questions. So there's a question here about pass rates for OSCE. So I've never known somebody who hasn't either passed first time or passed on second attempt. So it's 100% pass rate. It's very difficult to say how many people pass first time, and it varies. And I think we'll see a bit of a difference with the new OSCE exam things come into effect. But it's probably first time pass rate. What would you say the percentage was, Tella?
Oh, hard to say, but like I just know for the fact that we always get 100%, so everybody gets a registration in the end.
Yes.
So I think that's reassurance enough.
Yeah.
And as far as I know, for Devon, our first time passing rate is the same as the national average rate.
Yeah.
I don't know the exact numbers, but I do know that for sure.
Yeah. And also, if you do fail on that first attempt, you only have to go back and redo the bits you failed on. So, for example, if you failed on, I don't know, CSU or fluid balance, you only have to go back and do those 2 stations. So that's much easier. You don't have to do it all again. So there's a question here. After reaching the UK, how much time do we have to practice before appearing for OSCE? So dependent on what organisation you're going to, but it's you normally have 2 to 3 weeks of OSCE training, and that's full time. So you have more than enough of that OSCE teaching, but also, you know, for that, when you're having your OSCE training, you need to absolutely consume yourself with OSCE. So you need to be practicing it at weekends. You need to be, you know, within that group, you need to be going to one of their houses and practicing on a Saturday and a Sunday, and just keep doing it, keep doing it. And I see groups of international nurses. So I'm actually based in North Devon. I see them doing that in coffee shops in town with their OSCE handbooks out, and they're going through it, you know, while they're eating breakfast. And that you need to live and breathe it while you're doing it, just to have the highest chance of passing first time.
Yeah, I completely agree with that. The more effort you put in, the easier it will be for you.
Yeah. And then, you know, as soon as you get your OSCE pass, then, you know, you can apply for your NMC PIN number, and that's what it's all about, isn't it? And, you know, getting you to work as a band 5 trained nurse in Devon. So, no, absolutely. And I think a question that keeps coming up, it hasn't come up today, but I've been, because we have a Facebook page now for the Devon International Recruitment Hub, and I've been sent the same message a few times, just asking, are we providing family accommodation for people on arrival? Now, no, we don't. So we provide accommodation for the nurse, and our strong advice is that you come over on your own to begin with. You get your OSCE and stuff done, get your PIN, and then bring your family over, because by that point you've got time to look for housing, and all the rest of it. But that initial first 1-2 months, you need to throw yourself into the OSCE training, and we just don't have that family accommodation either. So that's how we always do it in Devon, and that works really well. And then by the time your family come over, you may have sourced housing, a house, and got everything settled. Okay, are there any more questions? Oh, is Tracy joining us? I don't know how. In the interview, I chose Plymouth Hospital. Does that mean I will get a placement in Plymouth University Hospital? Yeah, so Benny, yeah, so if you've chose Plymouth University, we do our absolute hardest to make sure you get Plymouth. And I can't see any reason why you wouldn't. We're currently allocating nurses to Plymouth at the moment. Okay, keep your questions coming in the chat box there. So what I thought I could do, we've just got a little bit of time now, just to have a little bit of fun with you all, in terms of Devon and local Devon traditions and things like that. I'm gonna I've made a teaching session on Devon local sayings in the UK. So the things that we say, different phrases, euphemisms, because although I all know that you've passed your English OET or IELTS, as with any country really, there are lots of different sayings that you may not have come across before. So I'm going to spend just 10-15 minutes going through this, and then at the end we're going to talk about how you make a Devon Cream Tea, because that is the most important element to you arriving to the UK. Okay, so if we go to the next slide. So these are some of the sayings. So I'm feeling under the weather. That actually means that you're feeling poorly. You're not feeling very well. Sometimes some people say I'm feeling under the weather. I need to spend a penny. So I can see Tella's laughing. Tella, did that one surprise you when you first come to the UK?
Yes, lucky for me, my friend had to find out the hard way before I did. So yes, she works in an elderly care ward, and one patient said, I need to spend a penny. And she kept saying, well, you can't go to the restaurant, just sit down. Something, and they had a proper argument. Well, not proper argument, but they were kind of like, come on, like, just stay in your bed for now. You need to rest and everything. And it was only when another nurse came in and explained it. So better her than me.
Yep. So some people will say I need to spend a penny. That means they need to go to the toilet. I have pins and needles is another saying for when you get cramp in your hands or you feel like you've got electricity in your fingers or your feet. They say I've got pins and needles. They're not literally stabbing themselves. So the bee's knees. So to put that into context, I could say, come and work in Devon. It's the bee's knees. And that literally means it's the best place to work. The bee's knees, yeah. Next slide, please. Right, so I have problems with my back passage. So that means they've got problems with their bottom, okay? I would love a cuppa. That means I would love a cup of tea. So you're probably aware of the amount of tea that we drink in England. So I would love a cuppa normally means I'd like a cup of tea. So as a picture there, it's got two children wearing their pajamas. I would like to wear my gym jams. That is pajamas. Okay, so quite a well-used saying amongst nurses is I am knackered, which means I'm really tired, really tired. Yeah, you'll hear that pretty soon on arrival to Devon. Mind your P's and Q's. So they might say that when you just have to be aware that you need to behave appropriately in whichever setting you're in and be careful with what you're saying. What's for tea? So obviously tea is what we drink, a cup of tea, but we also use that word in terms of dinner. So what's for tea is the same as what's for dinner. And I put a picture there in the right hand corner of an English roast dinner, which had you had a roast dinner before, Tella, before you came to the UK?
No, not really. I think the first time I had it was a few months after I first came here. Yeah.
And did you enjoy it?
Definitely. I have it once a week now.
Yeah. And do you have it on a Sunday?
Definitely, yes.
So an English tradition is on a Sunday we have a Sunday roast dinner, and that consists of vegetables, roast potatoes and roast meat, and it's making me hungry just talking about it. Okay, so I am gutted. So that is another phrase for saying I'm really disappointed. So I am gutted that it's raining today. Okay, I'm disappointed. So as the goose is there in the corner, I was sent on a wild goose chase. So try and put that into context. So I was sent on an errand that was fruitless. I was sent on an impossible task. I was sent on a wild goose chase is the same for that. Okay, so in the corner there is another tradition, beans on toast. We like lots of beans on toast in England, Heinz beans. So one of the sayings is you're full of beans, and that means you're full of energy today. We say you're full of beans. We would also say that's a load of rubbish, which means it's not very good. So I could say, oh, the weather, it's raining, that's a load of rubbish. It means it's not good. So another saying is it costs an arm and a leg, which means it's expensive. So I can say, okay, I've bought a new car today and it cost me an arm and a leg. So it's a lot of money. That's a rip-off. Another saying for that's a lot of money. So again, I've bought a new phone, but the price, well, that was a rip-off. It was too much money. It was expensive. Okay, so don't beat around the bush. That means don't, gosh, how can I explain this? Don't muck about. Get the initial task done, or say what you want to say. Don't beat around the bush. Just be direct. Actions speak louder than words. Oh, how do I explain that, Tella? Actions speak louder than words.
I don't know, actually.
So basically, that, I guess for me, that would be stop. Don't keep talking about it. Actually do it. Do it. See it through. So there's a cute little picture in the corner there. It's raining cats and dogs. It doesn't literally mean cats and dogs are falling out the sky. It just means it's raining really heavy. Some people say it's raining cats and dogs. Oh, we already had that one, and that's a ripoff. So it's a piece of cake. That means it's simple. So we could say the OSCE, it's a piece of cake. It's straightforward and it's easy. Okay, so that is the Devon flag. Okay, we're very proud of our county in Devon, and I'm hoping that link will work. And this is, I think this is the 2 Devon farmers talking with very heavy Devonshire accents. Please don't worry though, we don't all speak like this, and actually I struggle to understand what they're saying in that. I don't know if that hyperlink will work, Jack. I'm not sure. Okay, so can you understand what these Devon farmers are saying? I certainly couldn't, but this is just a bit of fun, so we'll listen to this.
Well, I've cut in there, it's the cobblestone and coloured red and colour. Somebody ploughed a quarter shining.
Is it?
Red and very
Yeah.
funny soil to deal with.
You know? Yeah.
Very funny soil to deal with. You catch it wrong, you've had it.
Yeah.
A big and goose eggs, actually.
Yeah.
God, this fowl, you couldn't get them in
You
the
couldn't break them down now?
No, you couldn't get them.
It's like they set again.
Yeah,
Yeah.
they do.
Yeah.
And that rock was,
Didn't like the strawberries, didn't
No,
like
no, it's true. Oh, for the first whole few years, they finished this one Saturday, don't they?
Yeah.
Hopefully we'll see the video now with captions underneath.
Well, I've cut in there, it's the cobblestone and coloured red and colour. Somebody ploughed a quarter shining.
Is it?
Red and very
Yeah.
funny soil to deal with.
You know? Yeah.
Very funny soil to deal with. You catch it wrong, you've had it.
Yeah.
A big and goose eggs, actually.
Yeah.
God, this fowl, you couldn't get them in the
You couldn't break them down now?
No, you couldn't get them.
It's like they set again.
Yeah,
Yeah.
they do. And that rock was,
Didn't like the strawberries, didn't
No,
like
no, it's true. Oh, for the first whole few years, they finished this one Saturday, don't they?
Yeah.
Thanks, Jack. Yeah, so it's just a bit of fun. So that's some Devon farmers, but I mean, Jack, have you ever heard as a Devon boy, have you ever heard farmers talking like that before. I just thought it was funny.
I'm actually not a Devon boy, so that's the first time I've ever heard it. I've been down here quite a few years now, but no, I'm from London, but I didn't have a clue what they were saying.
No, that's fine. So yeah, just to reassure you, yes, we do have accents like other parts of the country do, but yeah, you'll get used to it. And then I think there's another link on the next page. Right, okay, so this is the famous Devon Cream Tea. So this is one of the things that our county is famous for and that we're very proud about. And you will try this when you arrive in the UK for sure. And I know that the other international nurses they absolutely love it. So it's basically a scone, which is like it's like a cake, a hard cake. I wouldn't say it was a biscuit. It's almost like a hard cake, as you can see in the picture. It's cut in half. Then you cover each half with clotted cream, which is also Devon is known for. And then you add strawberry jam on top. Okay, right. So the big thing to remember here is to do it the proper way. Okay, and this is serious business now. The Devon way is cream first and jam second. Okay, the Cornwall way is jam then cream. Do not be confused with the Cornwall way. Okay, it's all about the cream first. That's really important that you all understand that. So I think we've got a video on the next page that talks through a cream tea. Great, thank you very much. Okay, so right, so that was Devon Cream Tea. So yeah, that last bit is just to have a little bit of fun, and so I hope you've enjoyed our webinar today. Obviously, you've had that brief introduction to OSCE from lovely Tella from one of our Devon hospitals, and hopefully we've been able to answer the majority of the questions there. And obviously we went on to about local English sayings and things, which I'm happy to revisit that at another point. Obviously we do run these webinars every Thursday between 10 and 11. Please tell everybody you know. These are open to everybody. And like I said before, at the moment you get your COS, I will be in contact with you and we'll be doing more support and more training with you. So just a massive thank you to Tella, who's joined us today. And I see Tracy from North Devon has been in the chat, but I don't think we could quite get her on the call, and that's fine. So thanks for joining us, Tracy, and thanks to Jack for being super whizzy as ever with the links and putting the PowerPoints up. And yeah, thank you all for your questions and for joining us, and we will see you next Thursday. So thanks, guys.
Thank you.
Bye everyone.
Bye.